Medicare Plan G is the most popular Medicare supplement plan sold in America. That's easy. And I usually say, if you live in a state that doesn't charge Medicare excess, you should really look at a Plan N instead of a Plan G. But you can really buy a Plan N in any state as long as you understand the difference between an N and the G. The biggest difference with a Plan N is that you might have some out-of-pocket costs, some surprise costs. That's kind of a popular term. Some surprise costs called Medicare excess. The reason I said if you live in certain states is because there are 6 states that don't allow that by their state law. So if you live in those states, Ohio, New York, Pennsylvania, I'll list them on the screen a little bit later, definitely look at a Plan N. The best reason to consider an N over a G, besides the benefits, and I'm going to go into that, is because a Plan N goes up a lot slower in price than a Plan G, and I'm going to show you some data at the end of this video to support that. But a G is the most popular plan. Most people buy it. If more people buy it, it's going to have more sick people buy it. It's going to have more total people buy it. The rates are going to go up much faster than an N that are basically it's going to have healthy people buy it and less people buy it. And like I said, I'll show you that data. But let's go back up a little bit. What is a Plan N versus a Plan G? Basically the same plan. You still pay the Part B deductible like you would in a G. In a G, that's all you pay out of pocket. But with an N, you'll have some additional out of pocket. You will pay $20 copay every time you see a doctor. But you can go to any doctor, okay? It's not a network plan like a Medicare Advantage plan. So sometimes I say a Medicare Supplement Plan N is a little bit in between a Medicare Supplement Plan G and a Medicare Advantage plan because you are paying $20 every time you go to the doctor. You will pay $50 copay when you go to the ER. So if it's something that you're not necessarily needing to go to the ER and you could get away with going to urgent care, you'll save that $50. So if it's definitely not broken and it's maybe sprained, go to urgent care. Save yourself the $50. So you'll pay the Part B deductible. You have a copay to see a doctor. You have a copay to go to the ER. No big deal, right? You can figure out how often you go to the doctor, and you can see that a Plan N typically saves you about $30 or more a month. So you're like, I don't see the doctor once a month. This is making sense that this is a cheaper plan. But this is the thing that keeps most insurance agents from selling Plan N because they don't fully understand it. And this is keeping most people from not buying it just because they're scared of this concept of excess. If you go to a doctor that does not accept Medicare assignment, and over 85% of the doctors in the country do, but you are unlucky enough to go to one that doesn't, that doctor is allowed to charge you up to 15% more than what Medicare approved. So people are like, woo-wee, that sounds like $10,000, $20,000. No, I've had many clients on Plan N for years, and I personally never had a client that's paid more than $200 out of pocket. Now, I'm sure that's going to change, but I'm telling you, that's been my experience having put people on Plan N for years, and I'm one of the few insurance agents that has enjoyed recommending a Plan N. Most agents, they won't even talk to you about it. They don't understand it. They're scared of it. I am not scared of it, and I have lots and lots of clients that are happy with it because most doctors don't charge excess. You're more likely to get excess with your high dollar specialists, nephrologists, anesthesiologists, any of those expensive specialists. They're the ones that are most likely to, but then again, you control it. Whenever you go to the doctor, you say, do you accept Medicare assignment? They have to have it posted by law in their waiting room. And if they say no, get a new one. Most of them, like I said, 85% of the country does, so you can control it. So most people are not that scared of excess once they understand what it is. But 15% still sounds scary. Like, how big of an amount is that? That's where you find out how little Medicare actually pays doctors. If I get a knee surgery, it's whatever the market will bear. My insurance could say it's $40,000 and whatever, they could pay it. Medicare is going to be like, no, we're going to pay $1,500. I am not joking. Google it. What Medicare pays for your services is very low, very low. It's horrifying, actually, what doctors get paid. That's why they don't want to take a lot of Medicare patients. It's even lower for Medicaid. Anyway, whatever Medicare pays, which is low, that doctor that doesn't accept it can get 15% more. That's why I said most of my clients that have actually had an excess charge, it was around $200. So it definitely didn't break their bank, especially when they saved over $30 a month, what they would have paid for a Plan G. Now, I said in certain states, I would always highly consider a Plan N, and these are those 6 states: Ohio, Connecticut, Massachusetts, New York, Minnesota, Rhode Island, Vermont. Because these states, their state law won't allow any doctor to charge excess. It's against the law. So if you're in one of those states, I would highly look at a Plan N instead of just going with a Plan G like everybody's going with a Plan G. Remember, if you go to the doctor a lot, you're already sick and you have a lot of doctors and a lot of chronic conditions, it might not be economical because you got to pay that $20 copay. But if you're the average person that's healthy that might see the doctor 3 times a year, you could save a lot of money and never have to worry about excess in those states. Now, if you do buy the plan in these states, but then let's say you're a snowbird and you go to Florida for the winter. Florida is one of the states that has most of the doctors that do charge excess, which is most of the retirees in Florida. So before you have somebody refer you to a doctor in Florida, ask them, do they accept Medicare assignment? If they do, no problem. If they don't, pass on them. Either go to another doctor that does so you don't get hit with that excess while you're in Florida, or figure out how much it is and you're like, if you're like $200, that's fine. I want to go to this guy. Just know what's happening so you're not shocked. Now, the other thing about a Plan N is since sick people aren't going to buy a Plan N, right? If I have to go to the doctor once a week, twice a week, I have a lot of chronic conditions, I'm not going to buy a Plan N. I don't want to pay that $20. It's going to eat up the savings. So sick people are not going to buy a Plan N. Healthy people are. And if a bunch of healthy people buy a Medicare supplement plan, that means the rates go up a lot slower than if they all went over here to the Plan G. So the rate increases for a Plan G, it varies based on your state. It varies on which company that you go with. But we'll say 5 to 10% a year, easy. Every year, for the rest of your life, whether you use it or not. It's going up. They're all going up. A Medicare supplement Plan N goes up a lot slower because it has healthier people. Less claims. So historically, we've had many years where it didn't go up at all. Okay? Now that it's becoming a little bit more popular, we're seeing 2, 3, 4% increases. So like half the rate of a G. So if your G is going to go up like this, your N is going to go up like this. So when you're on the golf course in 4 years and you're talking to your friend about their rates and they're complaining because theirs have gone up 10% a year for 3 years, and you're like, mine only went up 3% a year. That is one of the beauty of a Plan N. This shows you an average rate increase of a G against all companies and an N. And then the next one is listing 2 large insurance companies. I took their name off of it because I don't like when you talk about their rate increases. But this shows you across 6 different states what the F went up. And we haven't talked about F in this video, but F is a grandfathered plan that new people can't get, but millions of people have. So since new healthy people can't get it, you can see the F rates are going up the fastest. Then the red is the G rates. And you can see G's going up pretty steady, right? Inflation, medical inflation, people are getting sicker, getting older. And then the yellow is the N rates. This does vary by state. So an N rate in Iowa and Indiana didn't go up for these 2 insurance companies. Didn't go up at all in 2022. Illinois didn't go up at all. Didn't go up at all. It went up a lot more in South Carolina, and that can be a factor of a lot more people bought it or a lot sicker people bought it. But in general, it's still going up much, much slower than a Plan G. So if you feel comfortable with the moving parts, the $20 copay, the $50 for the ER, understanding how Medicare excess works, even if you're not in those states that don't allow excess, even if you are in Illinois or Indiana or Iowa that allow excess, you might be attracted to the Plan N because you're like, hey, I'm healthy. I hardly ever go to the doctor. I go to the doctor like once a year. So you could save not only monthly on your premium, which averages around $20, $30 a month, better than a kick in the butt. But as you age up, it goes up a lot slower than the other plans. So Plan G is the most popular plan in America. It's easy. If your budget's not tight, it's easy. I understand if you want to just grab Plan G. But if you want to be a little more strategic, definitely look into Plan N. And if you learned something in this video, there's a lot more great information on our website, themedicarefamily.com. Go check it out and subscribe to our channel. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.